This is Andrew Kramer from Urology Associates Cape Cod, bringing you a penile implant. This man has tried everything, pills, injections, vacuums, and what happens is he lost his erections, but then you start losing size, and you start getting this fibrosis in the penis, use it or lose it phenomenon, and ultimately he wanted to get this fixed. We are going to show you the steps, how we maximize length, do the dissection, and fix the scrotal skin to maximize length as well. In this case, again, little septum. The urethra is tethered by this little tongue of tissue, and when you take it down, you can fold the penis up and get lower down on the shaft of the penis. Again, more septum. And I'm showing you this step because I think it's important to show patients and other providers, here's what you do. When you take down that septum, look where I am on the shaft of the penis, way down, versus sort of at the higher up penis, which you could see how low I am on it. It could have been higher, and then the implant would go there, the tubing would come out really high, which should have shortened the penis. So once we're in, we're going to make our incisions in the corpora, left and right. There's one side, I'm going to go flip, and there's the other side. Usually show it differently, but in this I thought I'd just show you. Both sides, incision in the corpora is just the same. I'm dilating, and I'm going to fit in the implant. It's going to give me more time to show you the phalloplasty, which is trimming the skin. So I guess there's a few things we do as we put the reservoir, and a few things we do to push the envelope. If you can't change the length of the penis, I always tell patients you can. At least you can change the perceived length of the penis. So you can make it look bigger. You can look better. So cylinder on the left is going to go in. Cylinder on the right is going to go in. And once those cylinders are in, we're going to test it. Of course, I'm going to close the corpora. I've showed that so many times. I'm not going to show it in every video. But second cylinder is going to go in here. Use that little, it's called a hockey stick to get the cylinder all the way down. And once they're in, I'm going to test it. Now, I've put everything together already, so I'm skipping steps that I usually show, but I'm going to pump it up, and I'm going to like the way it looks. So pumping it up gives you all the length and girth that the patient could possibly have, and then some, because I think we've stretched and pushed the envelope and done those things with the septum to sort of keep the penis, get the cylinder in at its lowest, most proximal point. Once they're in, I'm going to show you the next step, which is called the ventral phalloplasty, your scrotoplasty. When you do that, that is going to change the sort of webbing there. See the skin? There's like a little turkey neck, and it attaches high up on the penis. So what can you do? You can trim that skin away. And when you trim the skin away, that enables you to put the attachment of the scrotum on a lower point on the penis. And if you do that, then you have more effective length. I have a patient coming up that was using condoms for whatever reason, and when he did, they were falling off because that skin there was making the condom sort of slip more distally. So when you do the phalloplasty, you have more effective penile shaft or length, whatever you want to call it. So in this case, I don't know if you're going to use the condoms or not, but it will give him that more effective length. So I've trimmed the skin off, and look, see that? It's a straight line. The scrotum doesn't attach high now. The scrotum attaches low. More effective shaft of penis. And when he closes multiple layers, the patient's going to have a good outcome and won't even see this incision. All he's going to know is what you did for him. So dissolvable stitches in the skin, closure, and he's already doing well. Day 2. This is Andrew Kramer, Urology Associates Cape Cod. Thank you so much.